Welcome back to our channel where we explore the innovations that shape the future of healthcare. Today, I am joined by someone who truly sits at the intersection of technology and patient care. Manuj Sanduja, co founder and CTO of Humeta, joining us all the way through Canada. Thank you, Manuj. It's great to have you here. Thank you for taking out time.
Thanks, Kanika, for having me here. It's a pleasure to be a part of this discussion.
Thank you. Thank you. So, Manuj, let's dive right in. Hospitals today are eager to bring AI into their workflows, but legacy EHRs, the electronic health record systems, often stand in the way. From your perspective as a CTO, as a Chief Technology Officer, what are the biggest technical hurdles when trying to integrate the AI with these older set of systems?
Right. I think healthcare is one of the most rich industries when it comes to the data across the world. But I think the irony is that the power of the data is very highly underutilized in this industry. So there are various studies where you will see that the data utilization or the potential of the data is well under 30% utilized there. So I think that's one of the reason why the legacy HRs are not being able to technically integrate with these modern world AI systems. So talking about the technical hurdles, I think there are quite a few of them. So, but we'll touch upon some crucial ones. Like for example, there is one of them which is like the legacy systems have a lot of proprietary formats of data that they use for communication between all the external systems. So having those proprietary formats of data makes them very restrictive in terms of interoperability. So whenever it comes for a newer age tools, they expect a standard formats like a FHIR formats, which is like a HL7 healthcare standard format developed. But these old legacy systems do not have those standardizations in place. Then another thing that we have noticed is that the records or the data or the patient's records that we have in these legacy systems are either they have missing fields there, and one of the very common problem is that there are a lot of duplicates there, and the simple reason for that is in these legacy systems there is no universal patient ID kind of a concept implemented. So there are a lot of duplicates data. So having a AI implementation, I think the most crucial part is your quality of data should be good. So it's like a simple formula: garbage in, garbage out. So if you feed in good data into your AI system, the output will definitely be good, but and vice versa. So the quality of data, I think that is the biggest problem what I see in these legacy systems. Another issue that I have seen while working on with these EHR systems is that infrastructure constraints. So probably these are old school, old style EHR systems. The AI infrastructure there is not that capable enough to handle the scale of the data that the AI needs to be integrated. So hence, there are EHR systems which are implemented on an on-prem infrastructure, which is again very limited to the scalability, which is they are robust infrastructure, but then when it comes to scalability, they restrict at a level. So I'll give you an example. I was working with one of the EHR systems for a very simple use case where we had to export the patient medication data and had to build an AI tool on top of that. But with a very simple use case also, I was not able to export that data just with all those FHIR standard. Those are standard for healthcare stuff. But what we had to do was we had to literally screen scrape the feed of these EHR systems into a AI tool. And you can imagine in 2025 doing this screen scraping thing, you can see what kind of a technical state these old legacy EHR systems are in.
Right. So talking about the old legacy EHR systems, if we talk about breaking these EHR silos, I think this comes up a lot in the healthcare
Yeah.
technology. Yeah. So, how do you see it from the infrastructure lens? If you could elaborate a little on that, since you mentioned the infrastructure part as well.
Yeah, I think from the infrastructure side of it, we need to change our mindset there, which says that
Mm,
AI infrastructure for a EHR system is not just the servers or the APIs that we are building there. It's a kind of a bridge between the raw data and the real patient impact. So the better the
mm,
infrastructure is, the better outcome you will have when it comes to AI component building on top of your legacy EHR systems. Another thing from the infrastructure side of it is that AI needs a lot of testing. So you need to retrain your models on your proprietary data. As I said,
mm,
EHRs have a lot of proprietary data with them, but since we do not have a like a stable sandbox environment, stable innovation investment on the infrastructure where the where the hospitals, or I would say the tech teams from the hospitals, can go and retrain and bring the model to a state where it is generating some valuable outputs from
mm,
there. So that
mm.
infrastructural constraints are, I think, pulling the AI implementations down from these EHR systems.
Right. So can we say the more unified the data foundation is, the more effective the AI solutions become?
Yes,
Yeah.
yes, that's right.
Yeah. So coming to the strategy part, if we talk about the strategy, say if we take a scenario, if you are in a hospital and the CIO is deciding whether to build the AI tools in-house or buy externally from a vendor, how do you think they should prioritize the infrastructural considerations?
So you mean whether to buy from a vendor or build internally?
Right, whether to buy or build internally, whichever option they pick, what all to be considered after they decide in continuation of that decision.
As I said, the way forward is standardization. So we
Yeah.
need to have some standard APIs built. So I mean, there is a FHIR standard, which
Yeah.
is the most common standards that we have right now, and every new age AI tool will expect that as output from a EHR system to build upon that data that the EHR provides. So I
Mm.
would not say that either build is good or a buy is good.
Okay.
My suggestion to any hospital that I have been working or I have been associated with is we should go with a hybrid approach.
Okay.
You cannot build everything in house because of course there is a technology cost and there is a resource cost as well,
Yeah.
and you cannot even outsource everything because the main challenge with the healthcare industry is, or specifically the EHRs, is that it has a lot of PII data and lot of PHI data where you cannot have that data exposed to the external cloud environments. So
Right.
my suggestion is not to follow a like a rip and a replace policy. You
Right.
cannot just go ahead and one fine day you decide that now the EHR system has to be replaced and you start replacing everything. So I would
Yeah.
suggest go pick one small module, maybe do a pilot on that, and implement a simple AI component on top of it without touching the base layer of the EHR systems. And that can be either, I mean, again, it is a combination. So you have all your low sensitive data sitting on premise with you
Right.
and not shared with the cloud.
Mm.
And similarly there are information like a model training. You want to do training, retraining, uh, you want to scale, you want to have a cloud infrastructure which is scalable and robust. That thing can go on a cloud environment and can be bought from some third party vendors, but when it
Vendors.
comes to handling your data, it has to be with you. I think there's no
Mm.
escape from that. So my
Right.
suggestion there will be a flexible cloud infrastructure, which is a hybrid between buy and, of course, build locally.
Mm.
Then there should be robust data pipelines. So probably I think one major challenge that we have while implementing any AI solution is that the pipelines. So from pipelines, you pass on data, but the data is not sanitized, data is not standardized. It goes into the AI model, and
Mm.
because it is not cleaned or sanitized properly, it gives you bad outputs. So probably
Yeah.
having a robust data pipelines will help with this hybrid infrastructure in place.
Right, right. So I think if we create a essentially, it's like creating an AI playground inside the
Exactly.
hospital infrastructure, and whichever works, then you can pivot from there,
Exactly. So
whichever
yeah,
is working best for you.
yeah, pick up the smallest of the module, grow on that, stabilize that, and then
Right,
keep on doing one by one. So it's like
right.
step by steps.
So looking ahead, Manoj, if you had to give a piece of advice to hospital technology leaders who want to be AI ready in the next 2 years, what would it be?
So from a technology perspective, I think uh, wherever I've been engaged with, there are few things that we should follow. As a hospital, I would suggest that uh, we should we should translate tech to the clinical outcome. So it's like building a robust infrastructure that is not just the servers and the APIs. That should help you to build, as you said, as a playground for the
Yeah.
hospitals to test, retest, train, retrain, and build a very robust infrastructure for a AI outcomes. And then interoperability. I think one of the, as I said, interoperability should be the priority from day one. Whoever starts to
Mm.
implement AI into their systems, your EHR system has to seamlessly integrate with all modern world AI systems. And lastly, again, start small and scale smart. This is what we
Right.
should follow. Start with a small pilot project, pilot module on your EHR system, maybe as simple as a clinical summary module of a EHR system, and then scale as you move forward and you have more confidence in the system that you are building.
Right. Wise words, Manoj. Start small and scale smart. Thank you so much for sharing such a clear, technical, yet a practical roadmap for making hospitals AI ready. That's it for today. Thank you so much for watching. If you enjoyed this conversation, if this added any value to your current ecosystem, please let us know in the comments below, and we'll be back soon with another episode. Thank you for watching.